So there's a request I sometimes receive on the job, as a nurse. This request sometimes comes in after everything has been done. The medication pass and every other thing that, I needed to do. And this is when a patient reaches out and you hear them say, can you pray with me? Or they will even say it loud. Hey, Sandra, can you please pray with me? And I want to tell you that what that moment actually is, because it is not ordinary. It is not ordinary. It is not just a religious request. So this is a person telling you, inside of them, I am scared. And I need something that medication cannot give to me. I need something that this environment cannot give to me. I need to know there is something bigger than this diagnosis in this room with me right now. I need to feel less alone in a way that medication and the treatment plan and the visiting hours cannot make me feel. I always feel so glad when I hear a patient say, can you pray with me? So that's what the request is anyways. And what we as caregivers do in that moment matters more than most people realize. Because we have a lot of people that do not believe. But we that understand, we understand. Because a patient who feels safe enough to bring their whole self into the room, their fear, their faith, their vulnerability, is a patient who is more likely to communicate clearly. It's a patient who is more likely to be honest about their symptoms, more likely to trust the medical process, and more likely to fight. And a patient who feels like their faith has to be left at the door of the hospital, like that part of them is inconvenient or irrelevant or unprofessional to even acknowledge, is a patient who closes up and performs that okayness while giving up on the inside. We do not want that. So the difference is not small. The difference between the one who can open up and the one who cannot, it's not small. Because the Bible says that the prayer of a righteous man availeth much. The prayer of a righteous man is powerful and effective, that we can find in James chapter 5 verse 16. Powerful. Those are not just mere spiritual words. You see, in that hospital room, in that moment, with a patient whose hand is reaching out to yours, those moments are clinical outcomes. Yes. Usually I would say they're therapeutic. Yeah. So when a patient asks us to pray with them, they're not asking us to abandon our training. No. I believe they're also asking us to complete it. We're there to care for them. Yes. Shalom, people.